Good morning and welcome to Western New York at Work TV. Today we have a very interesting conversation and something that's going to be near and dear to all of our community. We have Stan Martin, we have Pastor George Nicholas, and Kelly Marie. Good morning, everyone. Welcome to Western New York at Work, live here on BBZ TV, where we talk about the issues that affect the community. And today we have a very good show in store for you today. We have three professionals that are making and bringing change in the community of Western New York. And they really are addressing some social determinants and economic inequalities that are affecting our great city. And so without further ado, I'd like to bring in all three members that are just bringing this great message, starting with Mr. Stan Martin, Pastor George Nicholas, and Kelly Wofford. Everyone, welcome to Western New York at Work.
All right,
thank you. Thank you, Dale.
Okay. Stan, I'd like to start with you, and my goal is to individually have each of you explain just a little bit about your organization and its mission. And so, Stan, I'll start with you.
Great, Dale. Thank you once again for the opportunity to be on your show. Once again, my name is Stan Martin. I'm the project director of our REACH initiative. It's one of the initiatives under the umbrella of Cicatelli Associates, or CAI. And as a son of Buffalo, I moved back to Buffalo about a year and a half ago to really be a part of the change that we want to see. So I think there's tremendous opportunity that have availed themselves through our partnerships with Pastor Nicholas and the work that we're doing with Kelly and a few other partners that we're going to talk about later on today. So thank you.
Great. And welcome once again. And Pastor Nicholas, how about yourself?
Good morning. My name is Pastor George Nicholas. I have the honor and the privilege of being the senior pastor of Lincoln Memorial United Methodist Church, which is located at 641 Maston Avenue, right in the city of Buffalo. I'm also the chair of the African American Health Equity Task Force and the the Buffalo Center for Health Equity.
And Kelly.
Good morning. It is a pleasure to be here. I'm Kelly Marie Wofford. I am the founder and principal of Front Seat Life. Front Seat Life is an organization that was created to address mental health, the stigmas, the barriers for primarily women and communities of color, but truly for all people. It was birthed out of an interrupted suicide, and I had to learn how to live again. There weren't resources available to me, and because of that, I knew if I were dealing with the lack of resources, that someone else was as well. So Front Seat Life is really an organization that comes alongside someone. I provide mental health coaching, workshops, seminars. We are in the churches. I'm also a minister. And the goal really is to make sure people never end up in the situation that I was in.
And Kelly, let me ask you this question, because I think mental health carries a unwarranted and bad stigma in our community, in communities across the United States. And so from your standpoint, why is that the case, and what should we be doing to address it?
Well, it stems, you could take everything back to slavery, right? But I'll deal with the just last couple of generations with the belief that, Black don't crack, brown don't frown. We have to be these perfect people, not just in the workplace and in the community, but also at home. So at what point do you get to acknowledge the full spectrum of your feelings, the full spectrum of your life experiences?
Several years ago in particular, CAI, we applied for a grant through the CDC, the REACH grant, which is stands for an acronym, which stands for Racial and Ethnic Approaches Towards Community Health. And as the backbone organization, we partnered. I believe the reason why we got the grant was because of our partnership with Pastor Nicholas and the African American Health Equity Task Force, that really is designed to really look at how do we reduce, when Kelly was mentioning the physical health piece, how do we reduce, the chronic disease, in particular amongst the African American community, that really has some of the highest disparities. When you look at cancer, when you look at diabetes, as Kelly mentioned, when you look at asthma rates, that really has some of the high rates of chronic disease, not just here in Buffalo but nationwide. So as a result of our application, we were awarded a 5-year grant that allowed us the opportunity to look at how do we increase access to food and nutrition, healthy food, healthy nutrition, within our environment. How do we address, the community clinical linkages, that, oftentimes when we talk about historically, there's a distrust that takes place or that has existed between, the African American community and healthcare providers. And rightfully, when you look at some of the events over time that has happened. And, one of the areas, that was really near and dear to my heart, which we'll talk about later on, when you look at how the tobacco industry has targeted, the African American community and Black and brown communities overall with their deadly products, when used as intended, will kill you, which has resulted in, some underlying health conditions that we all are aware of. So as a part of that partnership, we've been able to work closely with the task force and other partners to really put forth a strategic plan, to move forward. So Pastor Nicholas may have some additional words to share.
Yes.
Well, Kelly mentioned, the enslavement of African people here in America, and that, that caused tremendous trauma, generational trauma that we as a nation haven't addressed, nor as we as a community kind of really unpacked what damage was done to us, and it's still inflicted upon us in terms of our self-image, and also legislative pieces that were that cut people of color out of the economic system, out of the educational system. I mean, these things were legalized segregation that denied opportunity to the descendants of slaves. And this has caused, for example, a tremendous wealth gap. So for every dollar an African American has, I'm talking about wealth, a white person has $18, right? And so what that means is that when wealth is oftentimes passed on generationally, and so those opportunities for people of color are not there. Why is that? Well, that's because of the structural and institutional racism that has been part of our story for so long. One of the outcomes of that is poor health. So in the African American community, when you look at the 5 zip codes that make up the African American community, 5 or 6 zip codes that make up the African American community in Buffalo, you will find that an African American who lives in one of those communities is 300% more likely to have a chronic disease than a white person that lives outside of those communities. That means heart disease, diabetes, hypertension, all these things. And what does that mean? It translates into 10 to 12 lost years of life. So African Americans are living less years on this planet, and that's a result or the impact of generational, structural, institutional racism, and the current practice of racism that exists in our culture on a day-to-day basis. I mean, just think about it, and I'll stop here. How ridiculous it is that when this pandemic came, we're mobilizing large groups of people to provide basic needs for most of the people in the community. That shows you the crisis that we've been talking about since we've known each other, because we have a shared vision that African Americans have the right to have the same quality of life as anybody else in this country. But in order to get there, it's going to require some collaboration, some structural change, and some dealing with some root causes.
Yes, and thank you so much. And I want to kind of stay there for a moment because the coronavirus, COVID-19 has really had a major impact on everyone, but especially the Black and brown communities. So I would like to just kind of get someone's opinion, everyone's opinion. What are you seeing, and what can we do about it? Because I think there's a number of things, but I would like to hear from from you guys as subject matter experts to a degree.
So when you look at how COVID-19 is impacting Black and brown communities, you have to look at the ability of people to work from home, the types of jobs that they have. When you look at frontline employees, so all frontline employees, I'm not talking about the doctors and the nurses and the firefighters and the police officers, those four professions get the most play, right? But the grocery store workers, the sanitation, workers, our grocery store clerks, bus drivers, CNAs, nursing assistants, the environmental services crew that cleans, the hospitals and buildings, right? When you look at those positions and the percentage of Black and brown people in those jobs, I don't want to say exponentially, right? But the number, the percentage of minorities in those positions outweigh the number of whites in those same positions, right? So even if you look at me and my ability to work from home, most of my colleagues don't have that same ability. Like, this is a blessing to be able to get up every morning and sit in front of my computer and not have to subject myself to everything that is going on outside of my home. This is not the standard. This is truly an anomaly. Like, I understand that. So when we look at the types of positions that people have and the flexibility that they have, childcare issues, and those are just the symptoms, right? That's the manifestation of racism and poverty that Pastor George was speaking about. So you have to make sure that when you are looking at how this affects people, you're looking at the whole picture.
Yes, I agree with much of what you said. And Pastor Nicholas, I'm going to come back over to you because, Kelly, she explained a great deal, but I'm pretty sure you have a perspective as well. And especially with members of your congregation.
Well, I mean, a couple of the things that we see is a sense of vulnerability, that knowing that I live in a situation and a circumstance where there's this virus that's swirling around the community and I'm really vulnerable. And then the other piece, real quickly, is the loss of ritual. And, I've lost 4 or 5 friends, probably more than that, in the past 10 weeks. I've lost family members in the past 10 weeks. And for us as African people living in America, one of the things that we held very dear, even in the midst of enslavement, Jim Crow, and all these things, was ritual, and especially the ritual of the funeral, where it was a sense of even in the midst of living under oppression, that at this time of celebrating this loved one from our community, was a sense of liberation, a sense of bringing folks together. We know as Black folks, we go to people who we tangentially know. We go to their funeral, right? We'll go to the person that delivers the mail, and you don't really know him, but you hear he dies. We go to funerals because it's a community gathering. Communities are community events for Black folks in America. And so we've had all these deaths that come into our communities that just has been happening. Deacons in churches, leaders, but we're not able to engage in ritual. And that's been really devastating for a lot of our people. And I don't think we're talking about that enough, to have these rituals when we have all these deaths, and not being able to do that adds to the trauma and doesn't allow for us to complete that circle, that healing circle that's necessary for all of us. And so that's something that, I hear a lot.
You're watching Western New York at Work TV. We're going to take a very short break. Don't go anywhere. We have more great conversation on the other side.
Hi, everyone. Lauren Lewis with Staff Buffalo. I wanted to talk with you guys today about building your personal brand. This had come up recently because I was working with a client who purchased our networking workshop that we do through Staff Buffalo. And I had an idea and knew this client a little bit beforehand and already knew that he was pretty good at networking. He went to events, sat on boards, volunteered. He kind of made his presence known a little bit kind of in that networking community. So going into the networking workshop, I was like, I wonder why he's interested in this networking workshop and, what he can get out of it. So I wanted to make sure I can make it as beneficial for him as possible since he was taking the time to do it. So I made a point initially, started talking about networking and why it's important. But I asked him what his goal was for the networking workshop that day. And he really said more about building his personal brand. So we started talking a lot about what it takes to build your personal brand. And I wanted to share some of that with you today. So first of all, you have to be very intentional and very consistent about who you are and what you want your brand to be. Whether it's the job you do, whether it's the company you work for, whether it's a business you own or a business you're trying to build, or the industry that you're in. Be very intentional and specific about it. I can think of a lot of people off the top of my head, I'm sure you can as well, who you know exactly what they do because they are extremely consistent with their brand. And you know who that go-to person is going to be when you want information on something. So very important, be intentional with it, be consistent with it. Another great thing to do to kind of create your brand is to create content and share it. Share it on social media, whether it's LinkedIn, Twitter, Facebook, Instagram, TikTok. The social media outlets are endless right now, and it's a great way to get your message out there and share information that you can be a subject matter expert on. You want to continue to be consistent with that as well. So if you're going to use social media to share an article you wrote or a video you created, kind of like I'm doing now, make sure that you are consistent and do it regularly. I know I've made this a goal of mine over the past couple months to be consistent with sharing videos with tips about career tips, interviewing, branding, all things related to developing your personal and professional self. Also, once you post it, keep an eye on other people in that industry that could benefit from the information you're sharing. Connect with them. They also might be someone who is building their brand in that same area you are, and you can share knowledge with each other. So like, comment, share content, share their content. Super important to continuing to build your brand. And it's personal and professional, which is, a great way to do things.
Western New York at Work is brought to you by our key business partners and many business professionals.
Bocce's Club Pizza, Staff Buffalo, Buffalo Healthy Living, CAI, Hope Buffalo, Embassy Suites, 716 Limousine. Welcome back to Western New York at Work. It's my understanding that the three of you have really mobilized other professionals in the community and have created a task force. I'd like to talk about that a little bit more and some of the initiatives that are coming as a result of that.
We've been able to work with the University of Buffalo and other people like Cicatelli Associates, ECMC, and many other community-based organizations to create the Buffalo Center for Health Equity that focuses on advocacy, research, community engagement, public policy, and I'm missing something else. And then the University of Buffalo has a research institute that's embedded into the university that focuses solely on the social determinants of health, and specifically on the east side or the inner city of Buffalo. So we've been able to birth these two entities that will be able to allow for us to have data and also programmatic responses and also policy responses that will address the social determinants of health.
Okay, because we hear this word social determinants of health, and I think it might mean different things to different people. And so, can you explain exactly to the novice individual in the community exactly what it is so that we can have a better understanding and also what we need to be doing about it?
So if you look at a person's health, this circle is the entire health of a person, right? 20% of that is healthcare. So if you take a 20% slice out of that 20% healthcare, so that's getting to the doctor, taking your medication, everything healthcare related, access, buses, all that stuff to get to the doctor. That's 20% of your whole health. 20 to 30% is behaviors. So personal behaviors, smoking, eating, but that also plays into that other percentage. But my personal decisions, what I can actively choose to do, that's 30% of a person's health. The rest of that are the social determinants of health. So built environment, what type of housing do you live in? We have a very old housing stock in Buffalo. So lead paint, the quality of the home, lead pipes bringing water into the house. Now the house may have new plumbing, but how old are the system in which the water is being brought to the home? Education, socioeconomic status. So where you work, how you work, what you're exposed to in your day-to-day life. Safety issues. The sidewalk, can you walk your sidewalk? So you have that 20% of healthcare, the doctor says go for a walk. But if you because of your built environment, simply because a municipality has not poured resources into where you live for you to feel safe, you can't even meet that 20%. So when we look at that whole 100% of a person's health, no matter what I do, if I did everything that I was supposed to do, including going to the doctors, so that's 20% and 30% of my whole health, that's only half of my health. I'm dead. Because of that, being a Black woman in Buffalo, living in the zip code that I will live in, I will live on average 10 to 12 years less than white Kelly, who does not live in that same zip code, made the exact same decisions, had a kid at 18, had half a PhD, like everything you can attribute to me as an individual. If you apply that to my white counterpart, she will live 10 to 12 years longer than I will because of the social determinants of health.
Del, the social determinants of health, where you live, where you learn, where you work, where our children play, and even where we pray, that environment, has a significance, a significant impact on our health, on our health outcomes and generations to come. And when you going back to your question earlier in terms of COVID-19, COVID-19, these are things that the black buffalo, I'm going to say, as Pastor Nicholas like to say, I had to borrow his phrase, or the Black community has really been experiencing throughout their since time, since time, and experiencing and been dealing with and have been resilient with, still not just surviving, thriving, despite these, challenges. And at the same time, now that this COVID-19, the pandemic, it has shined a light on the inequities, the health disparities and the inequities that have existed. So now, this is a point in time, in my opinion, that, we not only have to raise awareness, we have to educate and bring those who mostly are impacted. That's the community. The community, a lot of the strategies, the activities that we are implementing come exactly from the community. For example, under REACH, we have community wellness champions, from those 5 zip codes that Pastor Nicholas, mentioned earlier, that help inform our decision making. They have influence, they have real power, not perceived power, and they have authority. And these are those are 3 elements that oftentimes we are not at the table or part of the conversation. We're seen as part of the problem as opposed to a part of the solution. So the narrative is going through a paradigm, a shift, and changing that.
Well, hopefully this platform can be a complementary component to other initiatives that you would be doing. And that being said, are there any things that are going to be happening in the very near future that are addressing the many components of which each of you have spoken of?
In partnership, with Kelly and the task force, one of the things that we're hoping to launch in the weeks to come, and that is No Menthol Sundays. And that's where for World No Tobacco Day, which is May 31st, that's a Sunday, we're going to be working with the faith community, to once again utilize, their platform, to address some of the social determinants that we talked about.
So the Buffalo Center for Health Equity receives some district funding to be able to do some outreach directly to community members. There's 15 churches that are working together to call community members from East Side, West Side, Lackawanna, Niagara Falls, and to find out where they stand. What do they need? Do they need food, prescriptions, doctor's appointments? Have they been tested? Do they need to know where testing sites are? Because we know that we need to make that intentional, and we spoke about that before, that intentional connection. And then the other thing, we are addressing mental health through a Facebook Live program. Myself and Carl Shallahorn, who is another mental health advocate in the area, have Real Talk with Kelly and Carl every Tuesday and Thursday at 8:30 on Facebook Live.
Okay. And for any one of our viewers that's looking to either become a volunteer or just essentially looking for more information, is there a centralized, whether it be telephone number or web address that we want to direct them to?
Yes. So BuffaloHealthEquity.org is the website, and the email address is info@BuffaloHealthEquity.org. All communications, all questions, suggestions, people that want to get involved can reach us that way.
Fantastic. Well, we certainly here at Western New York at Work wish you nothing less than continued success and mobilizing even more like-minded leaders as yourselves to be a part of this, because it's going to take the entire community to make a difference.
The goal? To reduce teen pregnancy rates by 30% by the year 2020. The Hope Buffalo Initiative is on a mission to make Buffalo a healthier place for teens, with a focus set on 9 zip code areas where disparity rates of teen pregnancies are almost 2.5 times the national rate. The collaboration of strong community partners and with the financial support from OAH, Hope Buffalo has the tools to make measurable impacts in the lives of local youth, building a healthy future for teens and building a better future for our community.